When people hear about the word trismus, they think about difficulty opening the mouth. And while that's true, the story of trismus actually starts much earlier than people realize. I'm Lauren Meffin, a speech pathologist and certified lymphedema therapist, also a trismus intervention specialist. Today I want to talk to you about one of the most common side effects that I see in head and neck cancer survivors. It's one that doesn't get nearly enough attention. It's called trismus. So what exactly is trismus? It's difficulty opening the mouth, and in the rehab world, we define it as an opening that is less than 35 millimeters. But honestly, patients don't really care about millimeters. They care about function, the ability to eat, speak, and swallow, the ability to clean their mouths and the back of the oral cavity, and the ability to live their lives just as they did prior to cancer. Trismus develops when the muscles responsible for chewing the mouth opening are affected by cancer treatment. These involve the masseter, the medial and lateral pterygoids, the temporalis, and some muscles in the floor of the mouth. When radiation passes through these structures, it creates inflammation. That inflammation will stiffen over time into fibrosis. Those muscles will lose flexibility and jaw mobility. It often becomes more difficult to open the mouth as time goes on. But there's something that surprises many patients. I actually expect mouth opening to decrease during treatment. We commonly see around 30% reduction in the mouth opening during radiation. That doesn't necessarily mean that something is wrong. It means that the body is responding to treatment. Think about everything happening inside the mouth during radiation. Mucositis, ulcers, dry mouth, inflammation, swelling, pain. The body is always trying to heal and protect itself. During these stages, the aggressive stretching is not the answer. In my clinic, we don't wait until someone can't open their mouth. We don't wait until they can't fit a spoon into their mouth or until their dental exam shows that there's difficulty. We begin to talk about trismus the day the patient is diagnosed, because survivorship begins at diagnosis, not when treatment ends. Let me explain a little further. Imagine that you or your loved one have been diagnosed with head and neck cancer. You are now meeting with surgeons, radiation oncologist, medical oncologist, dentist, speech pathologist. Everyone is focused on treating the cancer, as they should be. And while everyone is focused on eliminating the cancer, I'm already thinking about what happens next. What will life look like 6 months from now, a year from now, 5 years from now? Will this patient be able to chew comfortably? Will they be able to swallow efficiently? Will they be able to communicate with their loved ones clearly? Will this patient be able to open their mouth enough to maintain these dental health? These are the questions that matter because cancer survivorship is more than just survival. It's about functional quality of life. It's about preserving the things that we do every day without thinking. One of the most important things we do first is measure the mouth opening. Every patient, every visit, every time. Because trismus does not happen overnight, it develops gradually. And when we measure early, we can identify changes before those significant limitations occur. Timing matters. Radiation-associated trismus is different from trismus following a dental procedure. It is different from that following a wisdom tooth extraction or any neurological related condition such as a stroke or Parkinson's disease. The cause of trismus matters, the timeline of trismus matters, and the treatment matters. Not all trismus is treated the same way. As treatment progresses, our role is to monitor, measure, educate, support. We want to help patients understand when are passive and active range of motions indicated. Passive range of motions help with circulation, lymphatic flow, tissue mobility, and comfort, while active range of motion can improve the mouth opening. Knowing when to use each approach is critical. One side effect that may occur during radiotherapy is oral mucositis or ulcerations. This is not the time to recommend trismus intervention. This is where trained speech-language pathologists, physical therapists, oral surgeons, and physicians who understand trismus can become very important in your care. Patients may ask, can trismus be cured? The answer is always the same. I don't think of trismus as something that we cure, but I think of it as something that is a daily battle. Radiation creates lifelong side effects to the tissues, and the fibrosis progression continues long after treatment. But here's the encouraging part. This is a battle. We win through education, consistency, stretching, exercise, manual therapy, and massage. We win through understanding our body and responding appropriately. Every week, I see survivors improve their mouth opening, their chewing, swallowing, communication, and quality of life. That is what winning the battle looks like. Research will tell us that approximately 17% of patients experience trismus at diagnosis, and 3 months after radiation, that number will increase to around 44%. 6 months, even 1 year later, still 1/3 of patients have difficulty opening their mouth. That is why education is so important and prevention matters. This is why we monitor from day one. We know there are certain risk factors that place patients at a higher risk of difficulty opening their mouth, such as tumor location, the staging of the tumor, how was the tumor treated, whether it was surgical or neck dissections, chemo, reirradiation, and the dental status all play a role in trismus risks. These factors help us understand which patients require more intensive monitoring and rehabilitation. Patients will ask us, can medications play a side effect in trismus? The answer is yes. Some medications will actually cause muscular jaw contraction. If you suspect that one of your medications is causing you difficulty with opening your mouth, it is best to speak with your physician and know that there's not a specific exercise. Our goal, however, with exercise is to change and improve the mouth opening. Every patient's treatment plan was different. Their cancer and radiotherapy was different. Every recovery is different. That is why trismus intervention is individualized. Over the years, one thing has become very clear to me. Patients need tools. Research tells us patients need tools, and because survivorship does not happen in the clinic, it happens at breakfast, dinner, brushing your teeth, while you are trying to put a spoon into your mouth, or just sitting in the dental chair. This is where the ARK-J Wedge became such an important part of our rehabilitation program. The wedge provides a structured way to work on mouth opening after appropriate time healing. It's not magic or a cure, it's just a tool. And when we use appropriately combined individualized programs, consistent rehabilitation, our patients will continue to make progress long after treatment ends. Over the years, additional resources such as the HNC Lymph SLP app have been created by us. That is because our patients deserve education right at their fingertips. Access to exercises, resource, and guidance continue throughout survivorship and the journey. The HNC Lymph SLP app was created to help patients manage long-term side effects from the comfort of their homes. If there's one thing I want you to remember, trismus is common, it is real, it is a lifelong side effect for many survivors. It is difficult to reverse, but it is not hopeless. The earlier that we can identify it and intervene, the greater the opportunity to preserve function and quality of life. Survivorship isn't simply about being cancer-free. It's about continuing to eat, swallow, speak, and connect with your loved ones and the people who matter most to you. That is why this work matters. If you'd like to learn more about Trismus rehabilitation, the ARK-J Wedge, download the HNC Lymph SLP, the app. You will find those links below. Thank you for allowing me to be a part of your survivorship journey. Keep following us for more videos to help you through exercises and finding your local speech-language pathologist or physical therapist who is specialized in trismus.